Hello everyone, my name is Dr. Naveed Khan and I'm one of the general practitioners working at Macduff Medical Practice here in Today I'm going to talk about one of the growing discussions among men in the community, which is prostate cancer. Now this sometimes usually stems from a family member or a friend being unfortunately diagnosed with it, or the patients having a blood test called as a PSA test done at their GP practice or at a private health center which has come back as abnormally high. Now this can understandably generate a lot of anxiety, but if we know certain facts around prostate cancer and PSA testing, this would not only help us in mitigating those anxieties, but also knowing when to reach out for help. So what is PSA and how reliable is this in picking up prostate cancer? Now PSA, short for prostate specific antigen, is basically a protein that is formed by your own prostate gland and can be picked up by a simple blood test. Now the interesting bit is that the levels of PSA may vary throughout the age. So what is abnormal may depend on what age bracket exactly you've fallen in. For example, raised PSA levels may be absolutely normal for someone between 60 and 70 years old as compared to younger men. Now there are certain conditions that can make your PSA levels go up. Some of these conditions may include a urine infection, an infection or inflammation of the prostate gland, or just a benign enlargement of the prostate gland that happens with age, which is also called as BPH. The other factors that increases the risk of having a prostate cancer is a strong family history. Studies have shown that if you have a father or a brother that was diagnosed with prostate cancer, then your risk is almost doubled. The risk goes even higher for men who have got several affected relatives with prostate cancer, especially if they were diagnosed at a younger age. Now, as PSA is not a conclusive test, therefore it is very important not to ignore your symptoms. Talking about the symptoms, some of the things that you want to keep an eye on would be any blood in your wee, frequent problems with urination, especially at night, any unexplained weight loss, any unusual back or bone pains that's disrupting your sleep. So in a nutshell, if you have been experiencing symptoms or you reckon that you belong to that high risk group with a strong family history, then please book an appointment to speak to your doctor for a prostate check and further discussion.